When an individual reaches sexual maturity, it opens up a whole new aspect to their lives that just typically makes things a lot more complicated. It makes their own life a lot more complicated and everybody else's too, like their parents, for example. Now, getting into relationships in high school and even junior high, that's fairly common. Roughly 67% of adolescents say that they've had a romantic relationship within the last year and a half, and most of those relationships do last about a year. What exactly those relationships involve, though, could vary from group to group pretty dramatically. But the partners that they choose do tend to be pretty similar in a lot of regards. They're similar in their physical attractiveness and in popularity for the most part. Now, like I said, there's a lot of variability here, but romantic relationships are highly desirable for most teenagers because it allows them to have a companion for this new chapter to their life that will also help them to explore their own sexuality. This is something that they personally want to learn quite a lot about. They have a lot of questions, so being able to explore their own sexuality is a huge appeal to them. And as they get older, having a partner like this will just allow them to open up and share their feelings. They'll be able to be more intimate. They'll be able to have someone they can trust and someone who will be there to support them. But like I said, it typically, this pursuit of sex and romance, it typically just makes things more complicated. You know, teens will pursue sexual behavior, and some teens will go all the way. There's a few factors, though, that we can try to identify to predict how far teens will go in these relationships. So being sexually active can be predicted by their parents and their peers' sexually permissive attitudes. So in other words, if their peers are cool with it, if they're, support it even, same with the parents, then the teen will just be more likely to pursue that. Another one is parents who aren't involved. So if parents aren't monitoring the kids, they're just more likely to, try things out, do their own little experiments, so to say. Another one is peer approval. Now this can be especially a big deal for young boys. I can tell you from experience, young boys like to, try to convince other young boys that they are getting all the activity. So this can put a lot of pressure on you if you actually believe what they're saying. So you want to fit in, you want to be part of the group, so that means you need to, try to keep up. Another one is greater physical maturity. So if you're more sexually and physically developed, then you'll attract more attention and more likely have opportunities to pursue those behaviors. Another one is alcohol consumption. So teens who are drinking a lot of alcohol are more likely to get involved in sexual behavior of some kind. Another risk factor, I guess you could say, is poverty. So teens who live in poorer areas, they're just more likely to engage in sex. And teens who aren't as fully developed in the executive functioning sense, like critical thinking. So that's that frontal lobe area. So younger teens that don't really have those good rational skills yet, are more likely to engage in sex. But when it comes to the difference between boys and girls, we do see some interesting things. Like when teenage girls have sex for the first time, they typically describe that partner in romantic way. They describe that partner as someone that they love. They have a lot of mixed feelings, like generally there's some happiness in there, and some excitement, but also fear and guilt and disappointment. It's a very complicated thing for these girls who have sex for the first time. For boys, it's not complicated. At least they don't talk about it like that. Boys typically describe their first partner as a casual date, and they express uniformly positive feelings. Now, I'm not trying to say boys are shallow, but what I'm saying is when they talk about that first experience, they usually talk about it in these very positive ways. They don't want to give any appearance of, having this more complicated stuff going on. So boys tend to talk about it in this more like social, like recreational kind of way. But it is certainly something that we should talk about. It's something parents should talk about to their kids, and teenagers should talk about with each other, because there are a lot of, really unfortunate consequences that can follow from sexual behavior, such as STDs. STDs, or sexually transmitted diseases, there's tons of them out there. And one of the scary things about most of them is that you could contract an STD and never know it. Many STDs can be asymptomatic, and that just means you have the disease, but you lack the obvious symptoms of that illness. This makes the disease much harder to detect and easier to transmit. So just imagine you contract an STD, but you never show a symptom. You would probably never realize it, and then everybody that you have sex with later on, they would get it from you, and they might actually suffer from it as a result. So it's very important, if you're going to be sexually active, no matter what your age is, if you're sexually active with different partners, to have yourself tested every so often. You don't want to be a carrier for some terrible disease. You don't want other people to suffer because you weren't being careful. Because some of these STDs, they are incredibly serious. They are deadly. Like HIV, the human immunodeficiency virus, that's what eventually leads to the development of the acquired immune deficiency syndrome, AIDS. And the AIDS doesn't really kill you, so to speak. AIDS, what it does is it just disables your immune system, and then other pathogens will kill you. So AIDS just makes you very weak, but AIDS doesn't actually kill you itself. But when it comes to AIDS, this is one of the scarier ones out there because we don't have a cure for it, and it is life-threatening if you contract it. But the unfortunate truth is that a lot of teens who contract HIV, it could have easily been avoided. 50% of new AIDS cases occurs in teens and young adults because they're just having risky sex, having unsafe sex, or they're sharing needles or something like that. So it's completely preventable disease that could literally end your life. So you need to be very careful of this kind of stuff. Now, there's a lot of different kinds of STDs out there. Here's just a short list of a few basic types and some specific ones that fall under those categories. So like some STDs are bacterial, like syphilis, gonorrhea. Some STDs are fungal, like candidiasis. Some STDs are parasitic, like crab louse, crabs. Then there's prozoal STDs like trichomoniasis. And then, of course, there's viral STDs like HPV and HSV and, of course, HIV. So the only real way to protect yourself against all these kinds of things is to just be mindful and be selective about your partners. Make sure you use safe sex practices, because there's a lot of stuff out there that you could get from being sexually active. I'd like to show you a little bit of data on this kind of thing from the CDC. So this is a map of the United States regarding HIV infection rate. And the darker blue the state is, the higher the number of HIV diagnoses per 100,000 people. So just take a moment and check this out, and you can kind of predict why this is the case for the states that are darker blue. The states that are darker blue typically have a lot more dense population. But there's other, like, political reasons too. Like, there's certain social policies that we see in these darker blue states that we don't see in the others. But we'll come back to this. Let's change the subject a little bit. So, besides STDs, there's another consequence that oftentimes is unintended that can result from sexual behavior, and that's of course, making a baby. Teenage pregnancy is a big problem. Roughly 1 in 6 teenage females will become pregnant. 50% of teens, when they have sex for the first time, will use contraception. Only 50%. A lot of these teens that don't use contraception the first time, they have these bizarre ideas, like they can't get they can't make a baby if they only do it once, or they can't make a baby if they, pull out at the last minute or something like that. Like, they just have these bizarre ideas that aren't really supported by anything. It's like a myth that they've picked up somewhere, and as a result of believing in this myth, now that they're going to unfortunately have a baby at a very young age. This could also be traced back to that illusion of invulnerability I was describing in the previous video. Like, they probably do realize on some level that they could get pregnant, but they just don't think it's going to happen to them. They can't believe it would happen to them. So what I'm trying to say here is, teens who have this, underdeveloped frontal lobe, they can't really rationalize through this stuff very well. So what they need is a lot of help. They need a lot of assistance from parents, from teachers, from adults in general. They need our good judgment to help them make good decisions. So what I'm talking about here is sex education. In places where we have had more comprehensive sex education, we've actually seen a dramatic increase in contraceptive use, and we've actually seen a decrease in teens' sexual behavior. That might sound a little strange, but the data quite clearly shows that if you explain how to have safe sex and what the dangers are of not having safe sex, like if you give teens all that information, then they actually make more rational decisions. I know, teens can be rational sometimes. It's pretty surprising to me too. But in this same field of research, we've looked at abstinence-only education, the complete opposite of this comprehensive sex ed. And we found that that just uniformly doesn't work. We've studied it again and again. We've looked at it in various states and different forms, but in every single case, we've seen that either it doesn't show any effectiveness, or it actually has the opposite of the intended effect. It actually leads to an increase in teen pregnancy and STD rates. So what we found quite clearly is that you can't just tell people to keep it in their pants. This is an innate drive that people have, and you can't ignore it. So the best thing you can do based on the research is to address it, to talk to your teens about it and explain to them, what this is all about. So here is another chart from the CDC. This is teen pregnancy rates by each state. So I'm sure you noticed some similarity with the previous map. So a lot of those southern states, like Texas in particular, I don't know what's going on in Texas's governmental policies, but whatever it is that they have in place to try to prevent teen pregnancy and the spread of STDs, it's not working. Like, when we look at the data, it seems pretty clear that whatever they're doing, it's not working. I know for a fact that they, and I believe all throughout Texas and many of these other dark red states, that they do teach things like abstinence-only sex ed and so on. So obviously it doesn't seem to be working. Now, something that a lot of these states that are in the darker red also fail to teach is issues of sexual orientation. In fact, in many of these states, they will just teach you only the negative aspects to being a homosexual or being bisexual. It's like they're trying to scare you away from being homosexual, like that's possible somehow. But anyways, when it comes to sexual orientation, most teens will be curious about it. Well, I shouldn't say most. Many teens will be curious about it. About 15% of teens do go through a period where they have some degree of emotional or sexual attraction to their same-sex friends. Now, I'm not saying that they're homosexual necessarily, they're just curious, they want to explore their sexuality, and this is a path that seems appealing to them potentially. But while 15% of teens are curious in this regard, only about 5% of them will actually identify themselves as gay or lesbian. And there's a reason for that. I'm sure you're well aware of the reason. Coming out as a homosexual, no matter what age you are, is going to cause a disruption for you, for your family, for your friends, and most likely for your classmates and coworkers. Being openly homosexual is going to set you up as a target for people who are homophobic. Openly homosexual teens do tend to endure a lot more verbal and physical attacks from their peers. And as a result from that, they suffer from a lot of depression and anxiety. So it is really sad and it is really unfortunate that this is the case, but homosexual teens, they don't really have many good options. They can either, pretend to be a heterosexual and just suffer quietly, suffer silently, or they can be openly homosexual and suffer perhaps much worse as a result. There's no right answer, it seems. But our culture is changing, times are changing, and hopefully this kind of situation will be a relic of the distant past. Now, coming out as a homosexual, it does tend to cause a lot of suffering on the part of the individual and their family. Their family, in many cases, do have to deal with more problems from society in general. But when we talk about teens in general, like the kind of suffering that teens in general might experience when they pursue their sexual interests, what we see is that some of them do get into more abusive kinds of relationships. About 25% of teenagers will experience physical, sexual, or emotional violence to some extent in this pursuit of a romantic relationship. There are certain ways to try to identify which teens are more likely to experience this kind of dating violence. The risk factors are parental discipline that is harsh or inconsistent, or if the parents are just uninvolved, like they don't monitor the teen's behavior. Teens who drink heavily. So there's a lot of reasons why that increases the probability of being a victim or a perpetrator. It just impairs your ability to think clearly and to send a clear message to other people what your intentions are, what your desires are. Another risk factor is if the teen holds traditional stereotypes about females being submissive and males being dominant. Another one is that if the teen believes that this behavior is also occurring in their peers. Like if their peers condone this kind of violence, then they'll be more willing to accept it. And the interesting thing about that is it goes both ways. So girls are more willing, they're more accepting of this kind of behavior directed at them if they think their friends are suffering in a similar way. It seems kind of messed up, but all I'm saying here is, in general, the way teens rationalize things, the way teens decide if something is moral, is by looking to see if their peers are doing it too. And then obviously teens who are more antisocial, more aggressive, and just have more stress, like if they're failing school, for example, they're more likely to be lashing out and violent. So what the research pretty clearly shows is what we need to do, what we need to try to explain to these teens who might get into these relationships, is you need to be very clear about what you want in the relationship, and you need to be receptive to the messages that are being sent to you as well. Like if somebody's telling you something and it's not what you want, you need to get out of there. You need to understand what they're saying, and you need to get out of there. So you need to be able to communicate more effectively. A lot of these violent, confrontations occur because of some kind of misunderstanding. It's not always a misunderstanding, but I'm just saying you can usually see those signals long before the bad stuff happens. So you need to be able to recognize that kind of stuff. And if things do start to go bad, you need to make your objections known and unmistakable. So don't leave any room for confusion. Make it very clear exactly what you want to happen and what you don't want to happen.